Michael Franti here on Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. The Centers for Disease Control and Prevention recently revealed the suicide rate in people aged 35 to 64 rose by nearly 30% over the past decade to 17.6 deaths per 100,000. The biggest increase was seen for men in their 50s, where the suicide rate increased 50%. Overall, suicides are now a greater cause of death in the United States than car accidents. CDC Director Thomas Frieden recently spoke to PBS NewsHour.
We don't know what specifically is causing it, but the trend has been consistent, and if anything, our numbers would underestimate the gravity of the problem. And of course, even one death from suicide is a terrible tragedy, and many of them are preventable. We know that in times of financial stress, there's generally an increase in suicides. We also know that this is a generation that grew up at a time when they expected more than some have been able to achieve in their lives, and also that they're stressed with what their kids are going through and what their parents are going through. So in some ways, the sandwich generation.
That's CDC Director Thomas Frieden on PBS. We're joined by David Stuckler and Sanjay Basu. They are authors of The Body Economic: Why Austerity Kills. David Stuckler is a senior research leader at Oxford University, and Sanjay Basu is an assistant professor of medicine and epidemiologist at Stanford University. If you could respond, Dr. Basu, to Dr. Frieden's comment.
Yeah, I certainly agree with Dr. Frieden's comment. And what we have found in our research is that these suicide rate spikes seem to correspond quite closely to state-level unemployment rates. And in particular, when we do these long-term studies that track individuals before the recession, during the recession, and after, we can control for their pre-existing mental health statistically, and we find that it's the new unemployment that seems to trigger new onset of depression and suicide, particularly among our most vulnerable adults over 50 who, when they lose a job, are often discriminated against or have a very hard time finding new work. There's a great deal of shame, and also it's quite hard for our healthcare system to access those individuals given the degree of barriers that they have, social barriers to accessing mental health care.
I mean, the point for people to understand in this country is what's unusual for us compared to other countries is that when we lose our jobs, we lose our health insurance.
Absolutely, and we do have some safety nets in the form of Medicaid, Medicare, but it's quite true that there are some large holes in that system, as has been repeated time and time again.
During an interview on Fox News in February, Republican Senator Lindsey Graham of South Carolina suggested slashing health care to stop scheduled sequester cuts from, quote, destroying the military.
The commander-in-chief came up with the idea of sequestration, destroying the military and putting a lot of good programs at risk. Here's my belief. Let's take Obamacare and put it on the table. You can make $86,000 a year in income and still get a government subsidy under Obamacare. Obamacare is destroying health care in this country. People are leaving the private sector because their companies can't afford to offer Obamacare. If you want to look at ways to find $1.2 trillion in savings over the next decade, let's look at Obamacare. Let's don't destroy the military and just cut blindly across the board.
David Stuckler, can you respond to Senator Graham?
Austerity in health is a false economy. The cliche, an ounce of prevention is worth a pound of cure, is really true. New York City officials learned this the hard way in the early 1990s when they cut TB prevention programs by $120 million, but ended up with a drug-resistant TB outbreak that cost more than $1.2 billion to control. What we found is that smart investments in public health can have a return on investment for each dollar of up to $3.
So talk about the healthcare system, Dr. Sanjay Basu, how sequester fits in, and also just what Lindsey Graham was talking about, Obamacare.
So I'm not a politician, and but I do analyze data, and I think in looking comparatively among OECD countries, you see a lot of false claims about the U.S. health system. Why is it that we cost so much more and seem to be getting less? I think comparing our country to other OECD nations provides some sense
You're
of
talking about
what
European countries.
European as well as Japan, Australia, and so forth. And you can see a lot of the myths by just looking at the data. So what are the theories? The theory is, for example, maybe it's just American obesity. Well, actually, the costs started well before American obesity and doesn't seem to correspond actually statistically to obesity. Maybe it's that we have an older population, but not so. Switzerland actually pays more in nursing home care. Japan has an older population, yet they still pay less while getting more in terms of health. Maybe it's just technology. We do a lot of research and development. But in fact, if you look at the Securities and Exchange Commission data, the R&D pharmaceutical industry, while
Research
making
and development of pharmaceutical companies.
Sure. Well, while they make a higher % profit as a percentage of revenue than any other Fortune 500 industry at the moment, they actually spend almost double on marketing as compared to research and development. And while we do use more technology and we do tend to have some higher costs from technology, it doesn't actually explain the majority of the bundle. What you do see, on the other hand, if you just look at the raw data, is that we get more incentives in order to test the people who are covered in order to bill more. And there's a lot of companies making quite a bit of money on that margin. You can go to one hospital across town and be charged double or more of what another hospital has on a different side of town. But it's not like a consumer market. If I'm in a car accident, I can't say to the surgeon, hold my hand there for a moment before sewing it back on. I'm just going to go across town and compare prices for a minute. So healthcare is a different kind of industry in which we have what is classically called market failure by the Nobel Prize winner Kenneth Arrow back in the 60s, but people ignored his work. I think what we really have is a system where we confuse inequality with choice. The majority of our costs come from common conditions and a small number of patients who have complications of diabetes, heart failure, hypertension. And we need more primary care prevention rather than paying for the ICU care.
I wanted to go back, and this is a theme you follow in the Body Economic, to the Depression. Going back to the Great Depression and the New Deal, this is President Franklin Delano Roosevelt speaking in 1933.
It is 3 months, my friends, since I have talked with the people of this country about our national problems. But during this period, many things have happened. And I am glad to say that the major part of them have greatly helped the well-being of the average citizen. In the short space of these few months, I am convinced that at least 4 million have been given employment. Or saying it another way, 40% of those seeking work have found it. That does not mean, my friends, that I am satisfied or that you are satisfied that our work is ended. We have a long way to go, but we are on the way. We come to the relief, for a moment, of those who are in danger of losing their farms or their homes. I have publicly asked that the foreclosure on farms and chattels and homes be delayed until every mortgagor in the country has had full opportunity to take advantage of federal credit. And I make the further request that if there is any family in the United States about to lose its home or its farm, that family should telegraph at once, either to the Farm Credit Administration or the Home Loan Corporation in Washington, requesting their help.
That was President Franklin Roosevelt in 1933. I think this is going to be very interesting for a lot of people listening and watching this today. David Stuckler, the choices made then and the choices being made today.
Completely different. Roosevelt took bold steps at a time when debt was 180% of GDP to boost financial relief to the newly unemployed, to save Americans from homelessness. And we've studied the effects of his landmark program, the New Deal, on health. And what we found is that comparing the states, the red and blue states, that pushed it to different degrees, the blue states tended to go further with the New Deal than the red states, led to a polarization in public health outcomes across the U.S. The greater relief spending implemented under the New Deal helped reduce suicides, reduce tuberculosis and pneumonias, and was in fact the biggest and one of the most effective public health programs on U.S. soil.
When you hear politicians today saying we've got to cut Obamacare, we've got to cut health care in this country, talk about what you found, what it means for the economy to invest in public health.
Investing in public health is a wise choice in good times and an urgent necessity in the worst of times. Had austerity been organized like a clinical trial, it would have been discontinued given evidence of its deadly side effects. There is an alternative choice that we found in the historical data and through the present recessions, that when we place people and their health at the center of economic recovery, it can help get our economy back on track faster and yield lasting dividends to our society.
The issue of the West Nile outbreak, can you talk about that?
Down in Bakersfield in California, there was a suspicion about why crows were dropping from the sky, and people were also showing up in hospitals. A variety of theories were posited, ranging from polio to heat stroke, but in fact it amounted to a West Nile outbreak that through a number of our colleagues' research, it was found that the abandoned and foreclosed homes had stagnant water and old swimming pools and other locations that were breeding mosquitoes. And this led to a rather large West Nile outbreak. Indeed, the reason why it was discovered was something called the California Encephalitis Project, a group of public system laboratories that work in concert with the CDC. And ironically, after helping to control that outbreak, they were closed due to budget cuts.
I want to turn to the issue of drug abuse. A recent film by Vice has brought renewed attention to the drug crisis in Greece, particularly the use of the new drug called Sisa. This is Haralampos Poulopoulos, head of Kathia, the main anti-drug center in Greece.
Sisa is a form of crystal methamphetamine. They use amphetamines and some other liquids, sometimes battery liquids, to produce this drug. It's very dangerous for the health of the users. I think the main reason of the increase of Sisa is the changes of the attitudes of drug users during the crisis. They are more self-destructive. We have 27% unemployment, 62% the young people under 25. We didn't finish yet with the crisis. We are in the middle of the crisis.
Haralampos Poulopoulos, head of the main anti-drug center in Greece, David Stuckler, and talk about that and also relate it to here as we wrap up.
This is a devastating situation we're seeing in Greece, with a drug crisis escalating at a time when drug prevention budgets are being cut. With gaping holes in social safety nets from austerity, people are becoming desperate, turning to the means of self-harm. We've seen drug use and infected needles spread HIV, creating a rise of more than 200%, leading to an epicenter of HIV/AIDS spread in Europe. What we can learn from these mistakes and in areas where we see successes in policy is that recessions can hurt, but austerity kills. When politicians make smart choices to protect people during hard times, it doesn't happen at expensive recovery, but can help put our societies back on track to a happier, healthier future.
And here in the United States, how that translates into policy?
Currently, we're facing implementing a large sequester in the U.S. While it's too early to see the full health consequences, what we are seeing is the Women, Infants, Children's Health Program, which provides nutritional subsidies to women, will be forced to reduce those subsidies from 600,000 pregnant women, and that program's been linked to reducing infant mortality. We're also seeing large cuts to public housing budgets at a time when 1.4 million homes are still in foreclosure. We're concerned that if done rapidly and indiscriminately, that budget cuts in the U.S. could create a repeat of the disasters we're seeing in Europe.
Final comment, what most shocked you in writing The Body Politic, Sanjay Basu?
You know, coming from the public health field, we have something called the precautionary principle, which is that when idea or policy is controversial, we should first do whatever protects people the most. And what we're doing is entirely the opposite. We've essentially had a massive untested experiment. That experiment has failed, and it sounds like it's quite deadly given all the data through history.
I want to thank you both for being with us. Sanjay Basu is an epidemiologist at Stanford University, David Stuckler, Oxford University. Their new book out today, The Body Economic: Why Austerity Kills, Recessions, Budget Battles, and the Politics of Life.